Welcome to Animal Care Unleashed with Sonia. I'm Sonia Maiorano, Field Placement Advisor for the Animal Care Programs at Conestoga College. I'm also a registered veterinary technician, a certified canine massage therapist, an Ontario certified instructor, and a proud member of the ASMVT. But most importantly, I'm your host for this video series where we connect with professionals who inspire and guide our future animal care leaders. Today, I'm honored to welcome Dr. Renee Flemming, a veterinarian and longtime practice owner at the Guelph Animal Hospital. Dr. Flemming brings decades of experience in clinical practice, team leadership, and community service. Her professional accreditations are Bachelor of Science, Doctor of Veterinary Medicine, Certified Veterinary Medical Acupuncturist, Certified Veterinary Pain Practitioner. Dr. Flemming attended the University of Guelph, graduating with her Bachelor of Science in Biomedical Studies in the fall of 2000, and she started the Doctor of Veterinary Medicine program at the Ontario Veterinary College that same year. She graduated and began practicing in 2004. Her professional areas of interest are emergency medicine, soft tissue surgery with a focus on brachycephalic obstructive airway surgeries, anesthesia and analgesia, and chronic pain management. Dr. Flemming spends much of her time with volunteering with a focus on animals and children-based charities. She has traveled to Nunavut, Turks and Caicos, St. Lucia, and the Yukon with the Canadian Animal Assistance Team to participate in spay and neuter vaccination deworming programs. She has also performed over 500 surgeries in St. Lucia, working alongside Help Paws, which is Help Animal Welfare in St. Lucia. These volunteer trips are very important to Dr. Flemming, who feels strongly that professionals should contribute back whenever and wherever they can. She has also spayed or neutered over 800 animals as part of various volunteer programs. While at the Guelph Animal Hospital, Dr. Flemming can be found tending to anything with fur or scales. She sees a majority of our small mammal patients, rabbits, ferrets, rats, chinchillas, lizards, and so on, and treats them with the same caring and compassion that she does for our dog and cat patients. During quiet times, Dr. Flemming can often be found cuddling with a post-operative patient as they recover from surgery. She also has a special affinity for pets with squished faces. She is our resident bulldog expert. She has owned both English and French bulldogs and will, hopefully, never be without one in her family. Dr. Flemming has bulldog patients from Toronto to Windsor, and she adores them all. If you're not aware, the short-nosed breeds are prone to a variety of health conditions. They can have airway breathing difficulties, dental abnormalities, and a variety of other concerns. And she is dedicated to educating pet owners about their health risks and assisting in preventive care to help ensure a lifetime of health and happiness. Dr. Flemming and her husband John share their home with a very spoiled mix of critters. Currently, they have Hank, English Bulldog, and Gibby, a Potcake rescue from St. Lucia, and 3 cats, Gordy, Ernie, and Cheddar. They also have an axolotl named Axel Rose and 2 tortoises named Pedro and Sully. In addition to their furry, finned, and scaled family, they have 2 boys, Ewan and Asher. Her insights will help us reflect on the field and appreciate the vital role of veterinary technicians and assistants. So let's dive into today's topic, which is reflections on the field and appreciation for vet techs and vet assistants. So Dr. Flemming, thank you so much for coming and joining us. So to start, let's talk about your journey in veterinary medicine.
I guess I don't have the typical story that you may hear from others. So many of my classmates had wanted to be a veterinarian from the time that they were little kids. I knew I wanted to be in a medical profession of some sort, and I knew I wanted to help people. But it wasn't until I was in university that I started looking into veterinary medicine as an option. Even kind of up until the end when I was applying, writing my MCAT and making a decision of where to go, I still was considering medical school as an opportunity. And it just so happened that the requirements for vet school and the application process came before medicine, and so I applied to OBC, and I was fortunate enough to get admission. So that's how I got into this profession, and I'm so grateful. Like, as much as it wasn't something that I dreamed of from the time that I was a child, I think I'm so blessed to be in this field. It really meets all my needs as a professional, and even after working for 21 years, I still really enjoy what I do.
My gosh, that's an incredible story, from thinking about going into being a medical doctor to being a veterinarian. Wow. So we're going to talk about your experiences as a practice owner. So what has been the most rewarding part of owning a veterinary practice?
It's so nice to see your team grow. When you first start working with them and making different protocols and kind of coming together on your vision for how you see your practice. And it's also so rewarding to see your patients and their families grow up. I really enjoy, forming bonds with my clients and their families. Our practice has changed so much over, 18, 20 years. It's grown quite a bit from when, we first started, and I really enjoy being part of such a great team that we all share similar values and we want the same type of medicine and care, as a whole.
Yeah. So, okay, let's focus on the team that makes it possible. So how do veterinary technicians and assistants contribute to the success of a clinic?
We've really always believed that our technicians and veterinary assistants, they should work to their full ability. So we want to make sure that they use their training and that they're engaged, and that, really they enjoy their position as best as possible. So we've always maintained that, we want to make sure that we're using everyone within their skill set. And we encourage them to grow within, separate areas of interest. Focus their continuing education on things that they would like to bring into work. I think what a lot of the general public doesn't realize is, they may see the vet, the face of the clinic, the vet in the appointment, but so much of the care and dedication of their pet is really given by the technical team and the assistants.
Gotcha. That appreciation, it's really important. So we'll move into talking about hiring. So when hiring your veterinary technicians or assistants, what qualities exactly do you look for during that interview?
Yeah, and here again is where our team comes into play, because we do really like to use everyone when we're hiring someone, and really we're just looking for general fit. We know and trust that the programs that you have here will teach them what they need to know to get started. We're often looking for personality, and something else that I think is really important for younger students to be aware of is that it's okay to not know. So, we like someone who has, confidence in their abilities, but also confidence to know that they may need some coaching in certain areas. Because obviously, your school can only give you as much experience as it can, and we know that a lot of the learning happens in the real world.
Yeah, and for a practice like yours that's so busy, yeah, you need to be able to have students that, or new grads or whoever's working for you, that if they don't know, they need to ask, because
Absolutely.
Time is the essence when it comes to emergencies when you see them.
Mm-hmm, mm-hmm.
So beyond skills and culture, obviously fits matters as well. So how do you ensure a positive and supportive work environment for your team?
I think first and foremost, we're very open and inclusive, or maybe try a different word. We let people be who they are. So there's no particular rules about dress or anything like that. We also enjoy when our team members are friendly, but they don't necessarily have to be, friendly outside of clinic. There's no pressure on people to get together outside of work, but we all maintain that we want to respect each other in the workplace. We recognize that not every individual will get along with every other individual in the workplace, but as long as there's maturity and kind of mutual respect to be able to, work together. And a big thing that we talk about at the clinic all the time is just remember that it's always about the patient. There's, days where we're stressed or something, there's a sad case, or we're short-staffed, and it can be hard to, try and keep a smile on your face and keep going. But at the end of the day, the little pet that's in front of you is loved by a family, and they're depending on us to work together as a team. And that's been how we've practiced for a long time, and I think it helps our team, especially the younger members, really feel like they're involved in pet care, because we do, remind them all the time that I can only do my job if my techs do their job, if the VAs do their job, if the CCSs do their job. Yeah. So, a lot of times the vets are the ones who are getting the acknowledgement, but it's a whole team of people who put that care into place.
That's wonderful, yeah. So leadership also means adapting to change. So how has the veterinary field evolved since you started your career?
I mean, there's certain phases to that. I graduated in 2004, so, a couple decades ago. And I think across the board, we've all seen that, pets are really playing a more vital role in the family. I grew up with dogs, but, for a good part of my childhood, they were outdoor dogs. They had a dog house, and I'm almost embarrassed to say that now because it's not what you would see. Yeah. Here, we've gone from dogs maybe living outside part of the time to dogs sharing the bed with the family members. You only have to go into, the mall or PetSmart and you see, stockings for their pets. And so, pets are really, in a lot of ways for a lot of people, like very similar to children, and they're loved and adored, and that really has changed the face of medicine. When I first started practicing, having a pet go for an MRI or a CT scan, that was something, may only happen a few times a year. Mm-hmm. And now, especially when you work in the emergency department, that's multiple times a day. So I think, and this is part of the reason why I just so love this profession, is that we're really able to do what we're trained to do. So we don't have to, always just guess on what we think is going on. We get to work with the clients within their means and really get to the heart of what's happening. So that's been a big shift. The pandemic, we do have to talk about that. That was an interesting time for our profession. Initially, we weren't even sure if we would be allowed to practice. And then, when the government figured everything out, it was just, we were booming busy. Like, I think people were just at home and the stress of the pandemic, and they just wanted to make sure their pets were healthy. And then, coming out of that, we definitely saw a surge of like early retirement or people leaving the profession, particularly veterinary technicians. I think it was a really stressful time. So now, on the other side of that, there are some clinics who are struggling to, hire and keep vets and technicians and assistants just because we've seen such a shift. So,
gotcha. So, for what you see in the future, what trends do you anticipate shaping veterinary medicine in the next decade would happen?
Be interesting, and I think we've just gone through a shift with, my generation. I was taught to just, keep working, head down. You don't need lunch, you don't need breaks. And it's good seeing some of the newer graduates come through these programs, and they're being taught, like, it's okay to have lunch. Like, it's your legal right to do so. And so it's been interesting for me to kind of watch the shift of the work-life balance. And, just, being cognizant that we don't flip it too far the other way. And, that is something I'm seeing with some of our younger individuals where they, they do want to work, but maybe just not as much as we want them to or expect them to. So, I think we're going to kind of settle into that for the next few years. I can't see, like, this is such an industry to be a part of because pets will only continue to be a part of our lives. So, there's no worry for veterinary professionals, and, I think there'll always be careers out there for everybody involved. So yeah, I guess we'll see what the next 10 years brings.
That is something we're going to have to see. So I'd like to talk a little bit more about your volunteer work. So can you share your experiences volunteering for spay-neuter clinics in the South, or even up in Nunavut and the other many places it seems you've been traveling?
Yeah, I volunteered from the time I was a kid. I think I started in grade 6. And so it's always been a passion of mine to help my husband and I loved traveling, and so kind of initially, if we were looking at going away, I would start by calling the local humane society or shelter to find out if I could bring some donations or some medications. And then I learned of a few foundations that you can join, volunteer for, and they do trips, within Canada, around the world even. And I've really enjoyed doing that over the last 15 or so years. Not only is it fun to travel and see how other people live, but in some of these smaller communities, it's so heartwarming to see how much they love the animals they're caring for. Thinking of Nunavut or the Yukon, in a lot of these areas, the dogs do have shelter, but they stay outside unless it's, a very, very cold night. The cost for feeding dogs and cats in these areas it's so high, like just getting groceries and things to some of those smaller communities, but seeing what the community will do to make sure that the dogs get fed at night. And then, conversely, in some of the warmer countries, dogs and cats are mostly on the street, but it doesn't mean that someone's not feeding them every day and that there's not a bond there. So I think it's really taught me to appreciate the role of animals in different cultures, because sometimes when I'm traveling, I talk about doing dentistries on dogs, or that my dog has 4 dog beds, and they're like, they can't even imagine, but it doesn't mean that there's not love and affection there. So I think that's really important for everybody in the vet team to understand. And so the most of my work has been in St. Lucia. I helped a friend of mine with her shelter. And so I try to go down fairly routinely and not only help with the puppies that they've taken in for adoption, but we like to go to more remote areas of the island and really get some of those more mature dogs spayed or neutered so that we can really, really put a dent in this overpopulation that exists on the islands.
Wow. Renee, that's very inspiring. Oh boy. So for students that do want to help, are there opportunities for students or graduates that can volunteer in these programs?
Absolutely. Like there's many that are based in Canada. There's one big program out of OBC that works kind of in northern Ontario. And then there's some globally as well. So there's Global Vets, Canadian Animal Assistance Team. So I think there's ample opportunity for volunteerism. It can be tricky, like sometimes you have to pay for your flight and that can be a big cost, but of course there's always fundraising. But it's just such an amazing experience because you tend to be grouped with other people who have the same passion that you do. And I don't know, just seeing the lives that you can change while you're there. I wish I had time to do more of it. And I think, when I eventually wind down my career, that's probably something I'll still keep doing. Just, finding little places where I can go do a spay neuter clinic for a few days and
that's
just
awesome.
kind of give back.
That's so awesome. So Renee, what advice would you give to students that are entering the veterinary field right now and in the next year or two as they're graduating?
Well, it is nice if they can try and get some in-clinic experience, and I know that there are placement programs through the college, but reaching out to some local clinics or even your hometown clinic, maybe where you used to volunteer, because nothing beats hands-on learning. And I think something else that I think everyone should be aware of is just that we all have to pitch in a clinic. So there's not really, if a dog needs to go out, it doesn't matter if you're a vet or a vet tech or a VA, if everyone else is busy, like you want to pitch in. So I think if there's just a general willingness to learn, I think that's one of the most important things is, being active in the process, asking for help when you need it, and just see what different avenues, because mostly what we've talked about is clinic work, but it's so vast, the different job experiences. So, you've never been in a barn before, well, go volunteer with a large animal vet. You may actually find that you love it, but you've just never had that opportunity. So try and take advantage of all the different options that are out there.
Awesome. Well, thank you so much for joining us here on Animal Care Unleashed with Sonia. And a huge thank you to Dr. Renee Flemming for sharing her wisdom and experiences. As we close this series, I want to say that this has been an incredible pleasure to present these conversations. Our goal was to showcase the diversity of career paths available to veterinary assistants and technicians, and I hope that these episodes have inspired you to explore the many opportunities in this amazing field. So until next time, take care, keep learning, and thank you for being a part of this journey.